Hello. Listen, we are still in our heart health month. Last month, we talked about heart disease because it is the number one killer in people, period. It is the leading cause of death. And we talked about that during Valentine's Day, I know, but we talked about what we can do about it. If you missed that one, you definitely want to make sure you go and check that out. But we're still going to talk about cardiovascular diseases because cardiovascular disease is an umbrella and it includes heart attacks, it includes strokes or heart disease, it includes strokes, some peripheral vascular disease, all these different things. And one of the other ones we're going to talk about is stroke because stroke is the fifth leading cause of death. So that's a big deal. And we need to talk about it because there's some things that we can do to prevent it. So there's also some misconceptions that are out there. A lot of people think, oh, it's a mini stroke versus a major stroke. If I had a mini stroke, I'm good. We're going to talk about that. We're going to talk about what it really means to have a mini stroke. Is it a big deal? What are some things to look for? So it's going to be a lot of information today. I want you to bear with me and stay with me because I have a lot of information, but it's not going to be bad because you know me, I'm going to break it down. I'm going to make it very simple so that we can understand and get the parts that we need. But it's just going to be a good bit of information. Make sure you watch all the way to the end because I'm going to discuss a lot of different things about these little strokes, okay, that are not so little. If you are new and you are just now joining, hello and welcome. If you have been here for a while, thank you so much for continuing to watch. I am Dr. Ashley Booth. I'm a board certified family medicine physician, and I'm also the owner of Healing Beyond the Stethoscope Primary Care, where we specialize in personalized and holistic care. Now, I also provide practical health tips and tools that you can use in your everyday life. And before we get started, I just want you to go ahead and do those simple things that also help us out and help out our channel, which is subscribing and giving us a thumbs up if you like what you're watching, sharing it to other people, and then also comment because I love the comments. I want to know what you guys are thinking. Also want to know what it is that I can do to provide to make it make sense for you. So let's just go ahead and get into it. Strokes. Now, the reason why I'm talking about this and spending a lot of time on cardiovascular disease is not because it makes the headlines and, oh, it's the leading cause of disease, but it has become personal to me because I have seen it. As a physician, I have seen it, and I have seen it in a very short period of time. Residency for me was 3 years. And in that 3 year period, I saw more people have strokes than I really wanted to see. And one of the reasons that it was happening was because of uncontrolled blood pressure. There are a lot of other reasons for it, but I saw a lot of people having strokes in a very short period of time. And I absolutely did not like it. And I said, this is something that we have to get serious about. Now, I am very open and conservative when I do treatment with people. When people come in and we talk about, okay, this is the plan and this is how we're going to do it. This is how we're going to approach it. I'm very, what I like to say, conservative. I want to hear what you have to say and we go back and forth and we figure out what's the best thing. But when it comes to blood pressure, if your numbers are over and they say these are consistently over where they need to be, and this is where it says we need to do medication, I am strongly encouraging people to go ahead and take the medicine to keep them safe because I've seen what happens. I've gotten messages in my inbox from the hospital that says your patient has been admitted for a stroke. I've had people call me on the phone and say, Mom is in the hospital because she had a stroke. I had one patient that was very, very near and dear to me. Like all of my patients are near and dear, but this one was like really sweet. And then they sent a message and said she had a massive stroke and she didn't make it. So after that, I was like, I have to get serious about this. Strokes are not planned, blood pressure is not planned. So we need to figure out what we need to do because, like I said, strokes are the fifth leading cause of death. Now, it comes after some cancers, but it's still up there and it's still having a major issue and some effects on not only the person who has it, but also on the family and everything else as well. And like I said, one of the number one causes of it is uncontrolled blood pressure. And we can get this under control. We can either control it or we can prevent it. And that's my job. And that's what I want to help you with today. So before we even get into talking about strokes, let's talk about the brain. because that is where the stroke is going to affect us in the first place. The brain, I think a lot of times we take it for granted because we're able to do all the things that we need to do. We know that it helps us think, but the brain is the most important thing that we have outside of our heart, because our heart is going to keep us beating, keep us going. But our brain tells everybody what to do. The brain says you can talk, you can walk, you can do this, you can do that. As soon as something happens and it goes without oxygen for too long, those other body parts can't do what it can do. You can't walk, you can't talk, you can't move and do what you want to do, how you want to do it, when you want to do it. And depending on the location of where the brain didn't get the oxygen, determines what kind of side effects and stuff you are going to have. So know that. Now, when we get into the different strokes, there's different types. You have your ischemic strokes. And ischemic is a big word that says kind of like you're decreasing or you're losing blood flow. And that can be due to either a blood clot or you have some plaque. So you have a lot of buildup in that vessel, and it prevents the blood from flowing the way that it needs to go. When it decreases that, then you're going to lose the oxygen to that area. And what happens? That area dies and it's not able to really do what it needs to do. Then you have a hemorrhagic stroke. And that hemorrhagic, basically you're hemorrhaging, so you're bleeding out. So it is because something is bleeding. And a lot of times what happens is a blood vessel is weak and then it opens up. A lot of times it's due to high blood pressure, it could be due to other factors, but a lot of times that vessel is weak, it ruptures and you start to bleed out. And that again can be due to high blood pressure. But when we think of hemorrhagic strokes, a lot of people think of aneurysms. So you have your ischemic stroke and you have your hemorrhagic stroke. And then we have our little third one that's out there that a lot of people like to talk about, and those are our mini strokes, right? A lot of people say, oh, she just had a mini stroke. Stroke is a stroke is a stroke. I don't care what you had, it is a stroke. So let's talk about these little mini strokes or your TIAs. They're also known as transient ischemic attack. Transient means that kind of happens and then it goes away. Ischemic, still talking about that losing that blood flow, and attack. So that's what we have. We have a transient ischemic attack. And these are like warning signs of a stroke because what happens is the blood flow is blocked temporarily. Usually a clot is there and then that clot goes away. But what happens is you have symptoms and then those symptoms can resolve because that clot moves on and then you're okay. The thing is, when you're in it, you don't know that you're okay. And we don't know if it is a TIA or what kind of stroke you're having in that moment because everybody's symptoms pretty much look the same. So it is still a medical emergency. So again, when you have a TIA, a lot of times people don't know that you've had one until like after you have sought treatment. And the thing is, if you have some symptoms that last and then they get better, so say someone sees that you have some of these symptoms of a stroke and then they go away by the time the ambulance come, you still need to get in the ambulance. You still need to go and get treated. You still need to follow up with your primary because what we do know is that this stroke, the TIA or your mini strokes, they actually can lead to a major stroke in a year. It is an indicator of your risk of having a major stroke in a year. So you still need to treat it and get all of the things under control so that way you are okay. So it is your warning sign. It is one of those that sometimes you can bounce back from it, but you need to understand that it puts you at risk and at significant risk for a major stroke. So it tells you I still need to be evaluated. Someone still needs to figure out why did you have this? We still need to figure out what your risk factors are and get them under control because if these are not treated and they are not taken care of, your risk of having a major stroke goes up significantly. Okay? And I talked about those symptoms of a stroke. They do a really good they put out a really good campaign called Be Fast, and it tells you how you can look at it. So the B is balance. If you are off balance, The E is eye. If you start losing vision in one eye, the other eye, both eyes at the same time, that is a concern. F, facial drooping. Then you have A, your arm. You can have some arm weakness. S is for slurred speech. And if you have any of those, then it is T, time to call 911. And again, if they show up and you're like fine afterwards, you still need to go and be evaluated because we need to figure out what happened. Because what they say is time is brain. And like I said, your brain pretty much helps you do everything. And if your brain loses oxygen for too long in one area or another, then you may not be able to gain function of doing those things again. The other things about stroke that I don't like is that it also disproportionately affects African Americans or Black people. It disproportionately affects us because Black people are more likely to have a second stroke in a year. So let's say you had one stroke. Within a year, you're more likely to have another stroke, and your risk is higher than someone else of another race. That's a problem. You're also more likely to have more complications from that stroke. So if you have one stroke, usually you have more complications from it, more serious complications from that stroke. That's again why it's really good idea to know what are the symptoms of it and getting help ASAP, right? The other thing is, and this one that I found alarming, but I've seen it and it makes sense. If you are less than 65 years old and you have diabetes, then you are more likely to have a stroke. Let's look at that again. If you are less than 65 years old and you have diabetes, you are more likely to have a stroke than any of the other races. And one of the things that plays into that is either the diabetes is not well controlled or the blood pressure, and you have a blood pressure issue, and that's what's also on top of that. Because a lot of people think, oh, that's the old person disease. I don't have to worry about that. But let's think about this. We talk a lot about high blood pressure. High blood pressure is diagnosed, the average age is in your 40s. So if you've hit and you're in your mid 40s, early 40s, if you're African American, because again, it hits us earlier, then you're going to have an issue. So know that this is not some old person's disease. And I've seen people in their 40s come into my office with a walker, come into my office with some arm weakness, all that kind of stuff because they had a stroke and they fit that criteria. Either the blood pressure was not well controlled or the diabetes. And so let's talk about this because I know we're talking about strokes and we're going to talk about prevention, but these are one of the things I'm going to tell you about prevention. Because one of the biggest things that I hear is I don't want to take medicine. And I hear you and I understand that. And I did a whole video on, talking about that and how we can think about it. But the other thing I want you to think about today, especially when it comes to stroke, it's give me one or give me five. That's what I'm going to tell you. You say, oh, I don't want to take medicine. You can either take that one or two medicines that you have to get your blood pressure under control, because that's usually, like I said, that's your number one risk factor, the number one cause of it. So you can get your blood pressure down and take the medicine to keep your blood pressure down to prevent it. Or you're going to end up with five. And I know everybody talking about you want to secure the bag. This is not a bag that you want because you are going to end up with a bag full of medicine. You're going to end up with like maybe five medicines and it's non-negotiable. And it's not like I'm making this up because you're going to end up with blood pressure medicines, probably two, end up a medicine for cholesterol, a blood thinner, and then an antiplatelet. So you can easily end up with about five medications just because of that one incident and from that stroke. And understand that a lot of these medicines don't move. Some of them they'll take you off of them, but you're still going to end up with probably about three that you have to keep on you at all times to prevent another stroke. So when you think about, well, I don't want to take the medicine, think about taking the one or the five. And what someone told me recently to help them get over that mindset of taking medicine, it says, I'm going to honor myself today by taking it. So go ahead and honor yourself by taking your medication. There's nothing wrong with that because I know that I know that I know, and I've seen, and that's again why it's so personal to me is that I've seen the effects of this, not only on the person who is dealing with it, but their entire family, because other people are now going to have to step up and help out and all that kind of stuff. And you're probably one of those people who don't want to do that. You don't want to rely on other people. But unfortunately, when these strokes hit, they don't say how they're going to hit. They don't say, oh, okay, when you have a stroke, it's just going to be your arm, it's just going to be your leg, you're just going to have a little slurred speech. Everybody's stroke looks different. Some people are bedbound, some people are able to still walk, whatever it is, because it depends on which part of the brain that it hits. So we have no control over that. But you know, one thing that you do have control over is what you're going to do to help prevent it. So that's the one thing. The other thing that I get is people say, I don't have time. This is one of those things where I say, okay, I get that. But what I do know is that if you don't make time for this, it's going to force you to make time for it. And how it's going to do that is going to automatically increase the number of doctors that you see and the number of visits that you have. So you may go from just having a primary care doctor that you see here and there, you may or may not take the medicine or whatever, right? To you are now having to see some therapists, and the type of therapist I'm talking about are a physical therapist, an occupational therapist, even a speech therapist. You're probably going to have to see those. Then the other thing is the other types of doctors that you'll have to see. Now you're looking into specialists, a neurologist, a cardiologist, maybe even a vascular surgeon, because they look at the blood vessels and stuff and they're going to check those out to make sure that you're okay, because that's all a part of the cardiovascular system, right? So we have to look at the blood vessels and see how things are flowing. So if you don't make time for it, it's going to force you to make time for it. And again, this is not one of the things that you want to be forced to do. You don't want to have to go to these doctors if you don't want to, when you could just keep your one, just keep your primary, right? And then you could do the other people if you have to. But that's the thing that I want you to think about. And the other things that you can do to prevent it is think about these risk factors and keeping them under control. So some of the things that you can control is your diet, what you're eating. You want the green leafy stuff. You also want to decrease your salt. African Americans are salt sensitive. There's a lot of studies that say that there's a lot of salt sensitivity and that causes the blood pressure to go up. So decreasing the amount of salt that you have and that you add definitely help. Exercise, getting out, moving 30 minutes a day. You can't give me 30, give me 10, 3 times a day, and do some brisk walking. Also talked about Tai Chi and how that can help. So there's a lot of different things that you can do, and that will not only help decrease your heart rate, it can decrease your blood pressure, and it can also help with weight loss. So this like hits multiple different things, right? The other one is weight loss. We know that as your weight goes up, your risk of high blood pressure, diabetes, all of that goes up as well. So you want to look into that. Keeping the other things under control that you can. If you have high blood pressure, taking your medicine, checking in with your doctor, hey, this medicine makes me feel a certain way. Do you have any other medicines? What else do you have? Blah, blah, blah. Like looking at all of that to see what makes sense for you, but keeping your blood pressure under control, the diabetes under control. Because again, remember I said if you are less than 65 and you have diabetes, your risk of stroke goes up significantly. And then quit smoking. If you are smoking, that can dramatically reduce your risk of strokes because it can decrease your blood pressure and all those different things. So work on that. But you know, I also would be remiss if I didn't talk about partnering with your primary care doctor. And remember, I say partner. I'm not just saying go out there and pick somebody, right? Just picking whoever you can get in with quickly. You want to partner with this person. You want to be able to form a relationship with them so that they understand you, they hear you, they understand what you need. And then they say, okay, well, this is what we have going on. They explain it to you and give you a good layout on where you need to go with it. Because when you partner with your doctor, especially with your primary doctor, then you start to help prevent certain things. My job as a primary care physician is to help prevent diseases. I know we see a lot of you guys for coughs and colds, and people are like, oh, I only go to them when I'm sick. But we actually want to see you when you're well, and we want to keep you well. So maximize your time and your use of your primary doctor, going and getting your checkups and all that kind of stuff to make sure that your blood pressure is where it needs to be. Because there are a lot of people who have come into my office and they look fine, they feel fine, but then when we do their checkup, we realize there's some things that are on here that are of concern that we need to get under control. And we need to start working on these things now to prevent it from getting out of hand. So you want to partner with your primary doctor. If you're out there and you're searching and you're looking, or you have one and you say, okay, this is not really clicking, this is not working, to start doing your due diligence. Look at some Google reviews, see who is in network with your insurance. If you don't have insurance, then you start looking at other providers like myself who see patients, whether or not they have insurance. I see people if you have them, if you're not, we are still accepting new patients. So you are very welcome to join us if you are in the Georgia and South Carolina area, because we practice what I like to say primary care ish. And what that means is we look at you as a whole person. We provide personalized, holistic care. We make sure that you are able to be seen when you need to by providing those same day, next day appointments and making sure that your concerns are heard. And you have longer visits, 30 to 60 minutes. And that's with me, that's not waiting time. We have a minimal wait time. So that way, if you can spend 30 to 60 minutes with somebody to fully sit down and talk about, okay, this is what's going on, this is how it's happening, and come up with a plan that you both can agree on, it makes a world of difference. And I know that it does because I've seen it. I've seen blood pressures go down. I've seen people come off of medication. I've seen people be in the diabetes range, come to pre-diabetes, and then they're out of that altogether. Like, it makes a difference being able to partner with somebody who listens to you, who gets you, and who's able to make sure that they prevent you having a stroke. Because listen, a stroke is no joke. So if you are in need of primary care, be sure to look us up. Our website is listed here, as long also with our phone number. You can click to enroll from our website. You can also go on there, give us a phone call so that you can schedule a free consultation. It's like 15 minutes. We talk about kind of what we do, how we do it. So that way you can see, does this make sense for me? How does this work? All that kind of stuff. Because we know sometimes you have questions. You can always reach out to us on our social media, all that kind of stuff, to kind of get a feel of what's going on. So that way you will understand and you know, because I know the main thing, a lot of times people perish and people suffer because of lack of knowledge. And I don't want you to do that. So if there's any questions that you have, be sure to look us up and reach out and let us know. But at the end of the day, I wish you well. I thank you so much for for watching, and I appreciate all of the support. Until next time, I will see you soon, and take care.